Hi, my name is Tina Martin, and I am a director of relationship-based care and a consultant with the Creative Healthcare Management Company. I'll tell you a little bit about myself. I've been a nurse for, like 38 years now, which seems crazy. My first 18 years of nursing, I did at the bedside as a clinical nurse in both med-surg, neuroscience, and then I did 12 years in a trauma neuro ICU. And it was during that time that, obviously you understand the importance of that patient relationship that you have as the caregiver and how important it is to their caring and to their healing and to their success. Went on then to do some leadership roles. And it was during that time that actually our hospital partnered with Creative Healthcare Management because we wanted to improve the patient experience and we wanted to support our healthcare team. And so partnering with relationship-based management, we brought on relationship-based care. And if you know anything about relationship-based care, it really focuses on that care of self and then care of colleague and care of the patient and their family. And I'm really sad to say, and this was probably in the early 90s, that when we introduced relationship-based care, it was the first time we actually gave our staff permission to care for themselves and to care for each other. Prior to that, the focus was consistently always on the patient and family. And not that that's not important. They're in the center of every decision that we make. But you have to care for yourself first so that you can bring your best self to work and support your colleagues and your coworkers so that you can collaborate and work interdependently actually with them and then provide that exceptional patient care. And so when I started working with Creative Healthcare Management at that time, and then several years later, we kind of re-engaged with them again and brought on our See Me as a Person workshop that Creative Healthcare Management offers. And that workshop really focuses on deepening the relationship that you do have with the patient and family. And it does that by using 4 therapeutic behaviors. So that behavior of attuning, which is really that deep listening and that one-on-one, like it's just you and the person that you're talking to, and being really conscious of not letting that outside noise kind of interrupt you, but really attuning so they feel heard. The second behavior then is wondering, and that's really when you kind of channel your inner 2-year-old and you start to wonder, like, why did they just say that? What do they mean by that? Why are they acting this way? And really start wondering, and then using that wondering thoughts to form these questions that then you're going to ask this person before you. And that's following. So following is really kind of hooking in to what your patient or the person you're talking to is saying or what they're doing. And so like if today you're really quiet, but yesterday when I interacted with you, you were all bubbly and happy, and that's kind of your norm, then I would really wonder to myself, gosh, I wonder why Mary is really quiet today. And then I'm going to say, hey, Mary, I'll take her aside and say, hey, you're just really quiet today. Is there something that I can do for you? And that's kind of following and kind of continuing on with that conversation. And then holding is, when you attune and wonder and follow, that holding then is the result of that. So when I do that with my colleagues or with my patients, they're going to feel that they can trust me, that I have their back, that I would be their advocate because I respect their values. I understand where they're coming from. I know their backstory because I've taken the time to learn more about them than just their diagnosis or just that they're one of my colleagues on my nursing unit. And so holding then is kind of the ultimate result of that attuning, wondering, and following. And when those 4 behaviors work, that's when that real deep relationship occurs. So whether that's that relationship then that you have with the patient and family in front of you, or whoever your customer might be, or with your colleagues and even with yourself, attuning and wondering and following with yourself.